views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to the Bronx Buzz. This is BronxNet's program where we talk to journalists and writers and editors and filmmakers and photographers, anybody really who puts stuff out in the Bronx. And we're extending the boundaries a little bit today into the borough of Queens and throughout all of New York City. And so our first guest this evening is David Brand. Nice to have you back with us on Bronx Talk.
Thanks for having me. Glad to be back.
I'm sure people of the Bronx will notice the Mets hat, but we will respect your choice because, you know, everybody's entitled to have their hometown. How are things over there? I mean, we certainly have heard about Elmhurst. Tough times, I guess, both for the parts of Queens and the Bronx.
Yeah, I mean, it's kind of crazy still how Queens has emerged as the epicenter of this crisis. I lived in Spain for a while after college, and friends I met over there have been messaging me on WhatsApp because this story has gone so international, just how hard hit Queens has been. It seems like things are starting to taper now when you look at the numbers in terms of new cases and deaths, but definitely not out of the woods. And so we have been covering a lot of what's been going on at the various hospitals in Queens, covering how there aren't enough hospitals in Queens. I think that's something that's been a criticism for many years, how hospitals have been closing over the past 2 decades. And now in a crisis, there were not enough beds. And so I think some of the coverage after this is going to be what are the efforts to build hospital capacity, to build bed capacity. So thinking of some of the longer term stories, but right now it's still kind of in the acute stage of covering what exactly is going on. And you know, who's recovering, what more needs to be done.
Dave, I didn't introduce you properly. David Brand is the Queens Daily Eagle editor and contributor at City Limits, so we just wanted to put that on the table. You know, there's a lot to say about that because for Queens, much of this, in a way, once you unravel what happened, was predictable, given the condensed immigration populations who come from all over the world. So you could understand that. And there are real interesting comparisons and contrastings to the borough of the Bronx because we actually have hospital space and infrastructure, but we have had historically epidemic proportions of asthma and diabetes and obesity and even drug addiction. So we were susceptible for a different reason. Certainly we have immigrant populations. And so for different reasons, we have our own sets of, I guess, parallel crises, so to speak. I do want to talk to you a little bit about a couple of things that you have written about. And one of them extensively is homelessness, which you have written about for City Limits. The governor was very clear that the homeless population in the subways is a risk. I mean, part of me was like, yeah, where have you been? But that's another issue. And then, of course, they actually closed the subways in the middle of the night now. Just give it an overall, what's your impression of all that? What's going on?
Well, my impression is that the person who has the most power to build affordable housing and to address the homelessness crisis during his tenure is kind of still moving in a reactionary way by closing the subways. They say it's for sanitizing the cars. It seems clear that it's also in part to move homeless people out of the subways who are more and more seeking refuge there. And so I think it would be great and to the benefit of everyone in the city, everyone in the state, if these kinds of reactionary measures were accompanied by a greater commitment to affordable housing for people who are experiencing homelessness.
Now, that's interesting. Of course, the logical next step would be, well, where are they going once they move them out? And if they're moving them into shelters, gee, you couldn't imagine that is a safer place,
Yeah.
you know, right now for people to be together. Although I guess from the sympathetic or the empathetic point of view, I could understand that the governor doesn't have that plan now. Would that he had that plan prior to this in
Well, yeah.
anticipation?
And that, I mean, he's been homeless people experiencing homelessness and their advocates have been critical of his response to this historic crisis throughout his tenure. And so I think another consequence of this crisis is now more and more people seeking refuge on the subway during a public health crisis. Because, like you said, people don't want to go into the shelter in many cases because it's the exact kind of congregate setting that we're being warned to stay away from. And so maybe you might have slightly better amenities there than on a subway car, but it's still like you're packed together with many people. And so right now, what advocates are calling for is to more rapidly open up hotel rooms for people experiencing homelessness so that they can isolate in hotel rooms rather than people packed together in shelters.
I hadn't thought about this till this discussion. We had the prospective field hospital at Van Cortlandt Park, and my friends at Van Cortlandt Park would really not be happy with me saying this. I wonder if we could, and not necessarily in Van Cortlandt Park, but find places that we could have homeless camps and build tents or do something, even for a temporary nature, before we really take a look at this. And, you and I can have this dialogue in the future. There are many things that I hope we learn from this particular experience. But this segues us to the whole question about eviction moratoriums. I actually appreciate this. I think this is obviously a very good thing. There are many people who simply can't pay their rent. But the way it's been laid out is you're going to kind of get a moratorium, come September or October or whenever these things are lifted. I mean, are they expecting people then to pay 6 months of rent, to pay all that back rent? And then if they don't, well, then they'll evict them. It's like, where are we going? So just your thoughts about how the legislation is and what might be done ultimately.
I think that's the ultimate question, because I think so far things have been done in a pretty ad hoc way without too much future planning involved. And so that's going to be really important, because as soon as the eviction moratorium ends, is that going to be all of a sudden a flood on housing court and marshals executing evictions more than they ever have before? So, I've heard some people in the state legislature talking about that they think that's going to get extended. Some people in the housing court system thinking that the moratorium is going to get extended. So in a short term, that will prevent people from getting evicted. But you're right, as soon as that moratorium ends, we're back right where we started. And in fact, more people are going to be at risk for becoming homeless because so many people have lost jobs. And so I think you're right that we need to start thinking about longer term solutions here.
I have many friends in Bronx real estate. Many of them are trying to do the right thing and not abusing their tenants, but they want to build, and they're certainly trying to make a living. The notion that we so cavalierly say, good, then let's just let them off for 6 months. They're like, what are you going to do about us? And then, of course, and this is not something we're going to deal with today, the answer seems to come down to more stimulus monies to take care of all of that. But that's probably another dialogue. Another aspect of homelessness that is personal to all of us, certainly in the Bronx, and I'm assuming in Queens, is the number of students, the number of kids that are homeless. I mean, here, I think the number here in the Bronx was 10% or more. You wrote about that for City Limits. Let's talk about how some of those kids might or might not be doing now. What is your sense of what you know and what you've written?
Well, you keep hearing people say that this crisis exposes or exacerbates a lot of the existing inequalities in New York City and across the region. And I think education and homelessness among families is just one of them, because once the schools move to remote learning, suddenly so many people, low-income students who don't have access to the internet, don't have access to consistent online resources, were getting left behind. And so the city wasn't prepared right off the bat to provide them with Wi-Fi, with web-enabled devices. And there's an added challenge because a lot of low-income families, parents work, don't have the option of staying home. And so they're still considered essential workers, struggling to come up with solutions for childcare while now educating kids at home. And this gap is just getting larger, I think.
Yeah, and in all the interviews I've done with Bronx elected officials about, inequities and all the things that you are talking about right now, everybody is saying, well, we've got to address these inequities. Well, push has come to shove. I mean, that's my point of view. One
Yeah.
thing about youth, which summer youth employment, obviously, for the moment, has been canceled, which I just heard about today, and I wonder if you're aware of it in Queens. Graffiti, large graffiti is starting once again. And
Oh, wow.
to me, it's totally predictable. I mean, you have teens with nothing to do, with nothing productive. Certainly, I mean, I can't speak for Queens, but in the Bronx, the kids are always creative. I mean,
Mhm.
and so now we're finding tags on, and even worse, it's almost like the perfect storm. All the gates are shuttered. You don't even have to do it in the middle of the night. You can walk up in the middle of the
New
day.
canvases. Yeah.
New
New
canvases.
canvases.
I mean, you say it jokingly, but that's actually
Yeah.
what's going on. So I guess just to summarize, like, what are you working on now, and what's going to be the next couple of things for either both the Daily Eagle, the Queens Daily Eagle, or for City Limits? What's on your mind?
Well, definitely from the citywide perspective for work for city limits, looking at the impact of this crisis on families experiencing homelessness, especially families who have recently transitioned out of homelessness and do have stable housing, but are more of a risk of becoming homeless again because maybe they've lost jobs, they're struggling to find childcare if they're in essential workforce. So taking a look at that. We have a lot of elections coming up. I mean, I think for the first time ever, a lot of us are not thinking so much about politics right now. And politics is usually we're getting bashed over the head with it. But pretty soon we're going to have a new Queensborough president. We have that election coming up on June 23rd, along with the presidential primary. So US president and Queensborough president. We have all the races in the state assembly and in Congress. So to link it up with the Bronx, we have AOC facing some challengers. So a lot to keep our eye on.
I will be, I guess, the first to mention this publicly anywhere. BronxNet is laying out 5 debates on Bronx Talk on my other program on BronxNet, and the first one we're going to do, I think we're going to record it. I don't know, Friday the 11th or whatever. I think. Well, wait a minute, the 11th, whatever it is, next Friday, not this Friday, but a week from Friday, we will be recording the debate in the 14th congressional district, and it'll air on Bronx Talk beginning Monday night, the 18th. So that will cool. give everybody something to talk about, and we'll be doing 5 of them. So nice. Listen, Dave, it's always a pleasure to have you. On your behalf, we'll say, let's go Mets. Although, one day, and, and let's stay in touch and, keep the communication between boroughs alive so we can fight for the same issues.
Let's do it. Thanks a lot for having me.
Thank you so much. Folks, we're going to take a short break, and we're going to do a very, very interesting interview with a gentleman who writes for a really interesting paper called The Middle East Eye, and he did a full study of the borough of the Bronx during this particular time. So thank you so much, David, and we'll be right back.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Okay, back with you on the Bronx Buzz. We are thrilled to have I would say a new reporter. He's probably not a new reporter, but he's a new reporter for us. And he has written what I thought was an absolutely extraordinary analysis of the Bronx during the coronavirus. The title of it was Coronavirus in the Bronx, Why the Poor Never Stood a Chance. And he wrote it for a publication called The Middle East Eye. We're going to learn a lot about that. My congratulations on a great piece, and welcome to Azad Essa. Nice to have you with us, sir.
Hi, thank you so much. Thank you so much for having me too.
Just tell me a little bit about you. So you are a journalist here in New York and New Jersey. Tell me about when you came here and what interested you in journalism.
I'm a journalist from South Africa. I basically have been working as a journalist for the past 12 years or so. Time flies by, I think. I used to work for Al Jazeera, and I used to be based in Doha. And my beat at the time was covering the African continent, mostly southern and central Africa. So that was what I used to cover generally. I moved to the US around 18 months ago, and I've been working for the Middle East Eye for just around a year. And I live in the greater New York area. I'm in New Jersey, but
Right.
coming to New York.
So did you come here for, and you can get as personal as you want, but did you come here for journalism because you thought this was a good place to do it, or just for other personal reasons? And again, I'm not looking to pry. I'm just curious about what brought you here, if it was journalism especially.
So it was a combination. It was for family reasons, as well as I thought that Trump being in power would make the place a little bit more interesting to report on. Meaning that all the smokes and mirrors of past administrations would be cast aside, and we're going to get to see America as it really is. And so, I thought it'd be a fascinating time to be here, where I think that a lot of struggles are going to come to light, and we had no idea that it'll come to light in
like this.
China. So I guess there was a dual purpose for me coming here.
And so you haven't, to my knowledge, you haven't written specifically about the Bronx. What do you generally write about? Is it about Muslim immigrants or Middle Easterners who are now here in the States?
Yeah. So I work for the Middle East Eye, which is a publication based in London, and we focus on topics and stories related to the Middle East. And my job in working here in New York is to focus on covering communities of color, and communities that are related to the Middle East. So with regards to, as you say, the Muslims, the Arab diaspora, but it also goes into like communities in South Asia and beyond, and even North Africa, even Sub-Saharan Africa. And so I cover a bit of politics, a little bit of culture, issues of race, and I try to sort of like dabble in trying to make sense of these different dimensions.
I didn't really delve into it, but I do want to mention when you talked about wanting to come here to cover Trump, and the way you phrased it was to see like how America really is. I do think that what Donald Trump has done was unmasked many things that were simmering in people. We've seen more racism. The anti-immigration fervor is just, I can't even imagine it. And certainly this crisis is beyond belief. Just to introduce the piece that you did and why it was so compelling to me, and I've said this on this program and other programs a number of times, that if you looked at the borough of the Bronx with its history of epidemics and asthma and diabetes and obesity and its issues with drugs, literally from heroin to crack, and then of course AIDS, and nowadays to all the opioids, you'd have to say if these are the people who are at risk, then you're going to get a center, you're going to get ground zero right here. And unfortunately, history has proven that to be true. What compelled you to study the Bronx, and then how did you go about learning about what I know instinctively and understanding really what goes on here?
No, I really appreciate you giving that context. To be honest with you, this was the first time that I had reported on the Bronx, so I was also very nervous to do so. because I didn't want to get it wrong, especially as I told you, I'm from South Africa, and I try to report from the continent in a way that doesn't look like it's written from an outsider perspective, someone like sort of like fetishizing the place, and I'll start off with some context with regards to the coronavirus coverage. I first reported from Queens on the coronavirus some weeks ago when the virus was, or rather, Queens was the epicenter of the virus. It still has the most number of deaths, but I think a lot of focus was falling onto Elmhurst Hospital and the conditions there, and so I wanted to report on the reasons why Queens was being hit so hard. And I try to zoom in on the question of social distancing and why expecting people to social distance when they're living in cramped housing and they're essential workers and these sort of things, that it was unfair, and then I wrote about remittances. And this focused on like a personal story of an Uber driver from Bangladesh who couldn't send money home just before Ramadan, started, a time when Muslims are sending money to their families for charity and for all kinds of events associated with the month. And I found that, immigrants were being hit so hard by this. And then I started reading a little bit more about the Bronx, and I realized that the Bronx had now emerged as the new epicenter, and that there were more infections and more deaths per capita. And what I had known about the Bronx, what the common sense knowledge about the Bronx was that it was the poorest area of the city. And so my mind immediately went on to exactly what you said now, is that when you consider all the other epidemics and all the other difficulties that the people of the Bronx have faced, I was wondering that was anything else, happening in the Bronx that would be different from Queens in terms of the response. We know like what is happening in Queens and what's happening in Brooklyn, and was the city and was the state government coming forward and trying to deal with the Bronx in a more active manner, in considering the difficulties that we already know. And so, of course, there are similarities between Queens and the Bronx when it comes to immigrants, poor housing, cramped homes, essential workers. But the Bronx was different because it was a lot more poorer. And I thought that I wanted to zoom in on that and try to figure out what was going on, basically.
Yeah. Well, you hit the nail right on the head. And I recall, and I had numerous discussions prior to the attention coming to the Bronx saying, you know what, given all of these factors, the Bronx is next, because there's no way we can, if that's what you say the risk factors are from a health perspective, then we have to be next. But one thing which you mentioned, which just kind of rings a bell, if you want to add another risk factor, poverty. Poverty is another risk. I mean, we talk about health risk factors, but, it creates I mean, we can go through all the issues, but it's very obvious. Another thing that the Bronx has, and you're not aware of it because we shoot these segments separately. We just had an interview with coincidentally, a Queens editor. And so we were talking about the differences between the Bronx and Queens. One of the differences is that Queens was starving for hospital beds, and the concept was exposed, and they had been closing hospitals in Queens, et cetera, et cetera. The Bronx is just the opposite. And I had a dialogue with elected officials, I don't know, just yesterday or the day before, about how healthcare is the largest industry in the Bronx. We have 35,000 healthcare workers, and yet we talk about a problem of access to healthcare. Doesn't seem to make sense. There is enough resource for everybody, but the question is, are immigrant people, do they trust, a lot of the institutions? Are there language issues? Are there cultural issues? I mean, there's a whole series of things. And certainly there's the undocumented issue that people are afraid to go in. And again, you put that cauldron together and you stir it up with a little touch of virus, and that's what you're going to get. You wrote about, and you mentioned it in your statement, you wrote about social distancing. And I had somebody, I think it was an elected official actually, in a town hall meeting I did, who said that social distancing also is an inequitable thing, because if you live in an apartment with a number of people, if you live in a building where people are really crammed together, it's very easy to say stay 6 feet apart, but it's not always possible to do that, right? So why don't you talk a little bit about the social distancing and how it plays or doesn't play in the things that you discovered?
No, 100%. One of the aspects of social distancing is that people forget that in places like Queens and places like the Bronx, there are multi-generational households. There are people who are not living on their own. They're living with different families, or they're living with an extended family. And within that extended family, you have people who are essential workers, who are working in restaurants or working for the city, and a lot of them are not protected, and so they come back and they bring that virus to the house. And so you're asking people to social distance, but then you're also cooping them up in an environment that's just asking for trouble. The other element is that you also have a lot of homeless people, and now you want people to social distance, but then where are the homeless meant to go? So there's so it's very simple, on one level. It's like, why don't you just stay at home? Why don't you?
Yeah, right.
Why don't you stay 6 feet apart? And it's like, some people can't do that.
Can't do it.
Yeah.
Before we run out of time, I just want to review, and it was very interesting because we know the large Hispanic population in the Bronx. We have, people from all over the world. We have a Russian population, Italian populations. We have people from all over the world. But you really underscored immigrants from Yemeni, Gambia, Bangladesh, or Central and South America, which we know. What did that provide challenges, or do you think it was intriguing to your readers? Just give me some of that before we gotta run. Sure.
So I was trying to center the experience of also like the Muslim working class. We discuss a lot of the time, Muslim immigrants, and a lot of the time class is left out of the equation. It's kind of like just representation, identity politics. But we're talking about trying to figure out what impact this virus has had on the poor, and a lot of the working class, whether they're Muslim, Jewish, or Christian, or atheist, if they're working class, they're experiencing very similar, they're having very similar life experiences to this virus, So I try to hone in on that and try to zoom. Did you find the final question here, because we're going to have to run, but did you find similarities between those immigrant populations, whereas some people may not see them that way? 100%. It's clearly the case. I spoke to a Bangladeshi activist and community organizer in Queens, and she told me that we don't and shouldn't be talking about the identity of groups. We should be talking about the class of them, because a lot of the time, we have been caught up. We do got to run. The paper is The Middle East Eye. You can look it up online. The piece that I was quite taken with was Coronavirus in the Bronx, Why the Poor Never Stood a Chance by Azad Essa. I'm hoping that you're going to write about the Bronx more. And if you want to talk to me about who you should write about or where it's happening, I'm happy to pursue that dialogue with you anytime, because you're a good writer, you're a thoughtful journalist, and that's what we need in the Bronx. Thank you very much, and take care. Thank you. Folks, that'll be the end of our program. We will see you next Monday night on Bronx Talk. We're going to go through businesses and organizations that have been particularly creative through this process so that they can survive, and maybe we'll all learn something about how we can do a lot better. Have a great night. Good night.